Fear, anxiety, stress, frustration, and even anger are among the emotions that are justifiably and appropriately felt each day by healthcare professionals the world over as these frontline soldiers continue to valiantly battle the resilient COVID-19 disease. As a result, psychological and emotional trauma are not uncommon disorders faced by medical professionals during this time. The reasons for such adverse psychological outcomes in them range from excessive workload, inadequate personal protective equipment, feeling inadequately supported, and the high infection rate among medical staff worldwide. Locally, the situation is no different as our nurses and doctors continue to selflessly grapple a health crisis for which they were ill-prepared since there was no recent precedents. Ward Manager of the Accident and Emergency Unit of the Georgetown Public Hospital Corporation, Jeanette Goodrich, explained to Nightly News the psychological transition experienced by herself and colleagues since the outbreak.
It took a while to come to Guyana, and I guess most of us didn't believe that we would have actually had the impact that we got. For the former part of it, we were a bit grumbled between standing our grounds and becoming overwhelmed with work and the trials of people coming to you and you're not sure if they have COVID-19 or not. So in work-wise, there was always this scare and this fright with nurses.
Goodrich explained, however, that the medical staff of the Georgetown Public Hospital Corporation braved the storm and are now better informed and equipped to serve their patients whilst protecting their physical and mental health.
Since we've had the first patient, so many persons were involved with that patient and had to be quarantined. Then it goes to show that they came out back to work, but some of them were still having nightmares, some of them were scared. But I think over time, they've come back to their normal self, brave self, and we've been able to become more stable in terms of work and seeing patients because now we have the screening points at the Gphc gates.
She linked the improved mental health of the staff to counseling provided by trained personnel from Gphc. Additionally, the new measures in place, such as the establishment of screening points at the entrances and exits of the hospital, has provided additional reassurance.
Our administration has always have an employee assistant who deals with any social issues and counseling, and we know in the Ministry of Public Health they've had their department call the nurses up so many times a day, their mental health calls to make sure that they're coping, what are their needs, how are they getting through, if they need someone to talk to further. So we've had a lot of calls from those departments, especially those persons who were exposed, to check up on them daily to make sure that they're doing fine and coping well.
Goodrich encouraged patients to be honest about their symptoms, since to do otherwise could be putting hundreds of lives at risk in the process. For the HGP Nightly News, Amel Griffith.